My depression, I think, honestly started the day I was diagnosed. I already had really bad anxiety before diagnosis, but it also got worse. Things that were causing me the nightmares was death, and that was causing me a lot of the anxiety, was the 6 to 8 weeks to live. And yes, I outlived that, but when is it my time? And even now, I still feel like death is just sitting there in the corner, waiting and watching me because I'm not a curable patient. When I was diagnosed, they gave me 6 to 8 weeks to live. And I was like in the ER getting diagnosed with that alone. Like, it was so crazy. Originally, they said it was non-Hodgkin's lymphoma, but then after doing more tests, they realized that it was acute lymphoblastic leukemia, both B and T cell, with other mutations. It was very sad to hear and very scary. I got my oncologist, and so I was then released from the hospital for about 4 days, just enough time to pack. And then in March, I started my stay where it was a six step kind of plan. I did radiation as well. Um, and then I did that for the whole month. Halfway through, my body, the mutations figured out the treatment plan and mutated itself to fight against the cancer or to fight against the treatment. So I was no longer in remission. Because of that, we couldn't finish the 6 step plan. So we went to Stanford, did a double CAR T cell therapy. I did it in June. Yeah. Um, and it was fantastic. And that put me in remission for a little while. Then I wasn't in remission again because of my body. And then we tried a bone marrow transplant. So they knocked everything out of my body. So I was in Stanford for about, at that point, 4 or 5 months already for the double CAR T. And then I was in there for another 5 to 6 months for the bone marrow transplant. Bone marrow transplant, honestly, I think was the hardest treatment I have been through. So this is why I say this was the hardest one. My depression hit me really hard at this point in the hospital. And although my family were coming to see me and were allowed to, it was still, I was alone a lot of the times and I just didn't feel great. When the mucositis hit me, it went from my mouth to my butt and it was so painful, but I was fighting the doctors on the pain meds because I was so afraid of becoming addicted to pain meds. So I was fighting them on it and I was like, no, I have to do it myself. Well, it got to the point where I couldn't talk because I was in so much pain and my lips were so swollen and they were bleeding. Um, so I ended up getting on the pain meds, which were very helpful. And I'm decided that I'm not going to fight doctors on it anymore. I had the mucositis. I also got C. diff at the same time, plus the side effects from the radiation and chemo, including nausea, vomiting, like smell, like your smells change. Smells can trigger the nausea and sickness, the diarrhea. There was a lot going on, and I did not feel good. And I was trying very hard to be positive, um, but it was difficult. difficult during that time. But I'm also very happy that it happened the way it did because I put myself like that was the hardest treatment. I was in so much pain and I actually probably lost the most weight during that treatment because I stopped eating completely. They had to feed me through a tube in my PICC line, and which the hardest weight loss program ever. I ended up losing like 100 and something pounds throughout the being diagnosed to my bone marrow transplant, the end of it. But it was also kind of annoying because they promised me my hair would fall out with every other treatment I got before then. And then they said when I did the bone marrow transplant, your hair is probably not going to fall out. And I was like, okay. And then my hair fell out, and I was so excited that my hair could fall out finally because I've been waiting for it to. And I wanted to take control of my cancer. So when I actually came out for those 4 days, I did a head shaving party with my family and friends, and I shaved my head. And actually, Jesse McCartney ended up doing an inspirational video for me. My family and friends got together and made that happen for me. So it was super fantastic to see that. And I've loved him since I was 5. So I was like, oh my gosh, I actually cried.
Who are thinking about you every single day, including myself. And we want you to know that this is going to be tough, but that we know you're going to get past this, you're going to get through this. And we cannot wait for you to start a brand new chapter and have a whole life in front of you.
My depression, I think, honestly started the day I was diagnosed. I already had really bad anxiety before diagnosis, but it also got worse. And I've been like this throughout the whole treatment. And I'm a very happy and positive person. And I believe that that is what's been helping me, like, also get such good results from my treatment. But it is okay to also have kind of that dark side along with your bright side. And in a way, it's kind of like yin and yang. And during my bone marrow transplant, my depression was really, really bad. And that is when the Stanford psychiatry department came to talk to me. And they ended up telling me that I actually had PTSD, anxiety, and depression, which made a lot of sense because I was having really bad nightmares at night about me dying, which would wake me up. And then I would be up for such a long time, I couldn't go back to sleep afterwards. And I was scared to sleep. And then it was during the day, I was just so unhappy. And then I wasn't eating because, I also have body dysmorphia that I recently learned about, but apparently I've had it my whole life. So that on top of everything, it was all just kind of piling up. And then I didn't know that, ordinary people could get PTSD. I thought it was just soldiers. So hearing that, looking into it, and realizing like that was kind of the cause to all of my nightmares and stuff like that, was it's in a way it's helpful to have a label on what's wrong with you. But the other thing is having a label doesn't change it and it doesn't fix it. Like you just know what it is and that's it. So it was nice to know, but it didn't really help fix it. It just gave it a name. And I have panic attacks constantly, even without, like, I will sometimes just be fine throughout the day. I'll be happy. And then so I will have to, for example, go to the grocery store. And this is something I deal with now is like I have to go to the grocery store to go get something. And I will have a panic attack because of germs. And I do wear a big pink HEPA mask and I sanitize my hands, but I'm so scared of getting sick and doing something to mess up whatever treatment I'm on that I react to it. And during the bone marrow transplant, my depression hit me so hard that when I was in the apartment with my mom, when I was released in the hospital, all I did was sleep. I was maybe awake for 30 minutes in a day, and that's how it was for a couple of months. It was just me sleeping, and it was really bad, and it hit me so hard. And I didn't get on medication or anything to help any of it until recently. But it was also because I wanted my body to feel. I wanted to figure out a way to get out of it myself. Um, I don't know why, because I'm a weirdo. Maybe I like torturing myself, I'm not sure. But I ended up going to therapy and two different group therapies, which helped me. My therapist is just like independent, and then the group therapies, one of them is for blood cancer, and one of them is an AYA program. I also did get put on medication for anxiety and the depression. And with my therapist, we worked on, like, for example, the things that were causing me the nightmares was death. And that was causing me a lot of the anxiety, was the 6 to 8 weeks to live. And yes, I outlived that, but when is it my time? And even now, I still feel like death is just sitting there in the corner waiting and watching me because I'm not a curable patient. And at some point, they say that this cancer is going to take me. But I also am pretty tough and I'm a fighter. So, like, we'll see what happens. We'll see who's right. um, but so having to work through accepting death as a potential, but just because with life is death, right? So just accepting it helped the nightmares go away, you know, and doing work like that, I think helped a lot. And to be in these support groups and also talk with people that know what you're going through and understand was super helpful and beneficial for me. And I wish I knew them because that didn't happen until last year. But when I was first diagnosed, and that first year when I was going through all these treatments so fast and going in and out of remissions, and I would have loved to be in these support groups and having this excess support besides my family and friends.
All right, you guys, I can
survive. But I will say, whoever is out there and you are battling cancer, you can do this. And I know that it's frustrating and it's hard, but just don't give up. Your emotions are completely validated 100%. You don't have to be positive all the time. It is great to be positive, but don't be toxic positivity, because I am my own toxic positivity. I thought in order to survive this cancer, I had to be positive all the time and kind of hold the darkness in. And that's not how it is. It's okay to let them live together. It's okay to scream and, cry and have those emotional moments. And actually, it's very cathartic to do that sometimes. And going on to online programs, like I found my group therapy, my blood cancer group therapy through Wellness Within. And on my website, like I have like a bunch of links, cancer links as well. So like finding cancer links to help you, whether you're AYA or not, is very helpful. Being completely honest with your caregivers, but also with your doctors on how you're feeling, and you telling them it's okay to say, I need therapy. It's okay to say, I need help sleeping. And whether you want to do it naturally or through something else, it's okay to just tell them everything. At this point, I'm an oversharer because I tell everyone everything that I'm thinking and I'm feeling. And I have found that when people ask, how are you doing? It's easier for me to say, emotionally, I'm this. Physically, I'm this. Spiritually, I'm this. That has been like the easiest way to answer that question for me, instead of just going, I'm fine, I'm happy. It's just because I've kind of compartmentalized everything. And knowing that you can do it, like even when times get hard, you are a fighter and you can do this. Like, you got this. The fight is worth it because the fight is you. You are the fight and you are completely worth it. And all feelings, whether negative or positive, those are okay to feel.